Good morning, everyone. Welcome to the Neonatal Intensive Care Unit at HSC Winnipeg. We'll turn it over to Stefano Grande, the President and CEO of the Foundation, to begin.
Thank you, Kat, and good morning, everyone. Thank you so much for joining us this morning. My name is Stefano Grande, and I'm President and CEO of the Children's Hospital Foundation of Manitoba. Welcome to this so special celebration of World Prematurity Day. I would like to begin by acknowledging that we are in Treaty 1 land, and that land on which we gather here is the traditional territory of the Anishinaabe, the Cree, the Ojibwe, the Dakota, and the Dene peoples, and the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. Thank you so much again for taking the time to be here today. We decided to try something a little bit different. Rather than all of us being remote in our own offices or homes, or maybe even the cottages or somewhere down south, we wanted to bring the NICU to you today on World Prematurity Day. So we will be joining our VP of Marketing Communications, Kat Fox, and the team in the patient room so you can see the actual care space. We will also hear from Dr. Michael Narvey, the section head of neonatology, medical director of the Child Health Transport Team, associate professor at the University of Manitoba, foundation board member, and last but not least, the social media star at NICU Musings and allthingsneonatal.com. Amanda Pineda, the director of NICU, is here also at the Health Science Center, and Karen Netzel, the coordinator of the Veteran Family Support Program, another program supported by you, our donors, and a mom who's also spent many months at the NICU with her own child. We'll be taking questions a little bit later as well, so please use the chat function and we will answer as many as we can. I would also like to acknowledge and recognize that we are honoring a generous gift by our friends at the Sandra Schmirler Foundation. And we're so delighted that the staff and board members of the foundation are also joining us here today from across the country. Welcome to Manitoba, everyone. Over the last dozen years, the Sandra Schmirler Foundation has granted nearly $300,000 to the NICU right here at our Health Science Center Children's Hospital. The most recent grant of $90,000 has enabled us to purchase 2 baby Leo incubators, just like the one you'll see in the room today. Donations and gifts and grants like these are so incredibly important to the families of the teams who care for the tiniest, most fragile babies from Manitoba, Northwestern Ontario, and as far north as Nunavut. Thank you on behalf of our staff, our board, the families, the leadership at our hospitals, the doctors and nurses. Thank you so much for your tremendous generosity. It's thanks to the support of folks like the Sandra Schmirler Foundation that we can continue to provide the latest equipment and resources to help the tiniest citizens grow and become healthier and healthier every single day. So now let's go over to NICU. Kat, over to you and the team.
Good heavens, I'm having a heck of a time with technology today. So I'm Kat Fox. I'm the VP Marketing Communications for Children's Hospital Foundation, and just delighted to be here today with the team at the NICU. Stefano mentioned, we've got Dr. Michael Narvi, Amanda Pineda, and Karen Netzel who are joining us. And we talked a little bit about the space and about how grateful we are to the Sandra Schmirler Foundation and to donors like you. So we thought we'd give you a bit of a tour. So we're going to ask Amanda if you can tell us a little bit about the model of care here in the NICU, a little bit about the facility, and then we'll have Dr. Narvi tell us a bit about the equipment itself and what it means to learners and parents and the staff here at the hospital.
For sure. Thank you very much, Kat. So I'd just like to take a moment to welcome everyone to our beautiful NICU here at HSC Winnipeg. So this is one of our single patient rooms here in the NICU. We do have 50 rooms in this beautiful, gorgeous NICU, most of them being single patient rooms. And we do have some double rooms to accommodate our multiple births. And I'm just going to kind of give you a bit of a walkthrough around to show you around. So we have this little entry when you walk into the door, where you will be washing your hands as parents and visitors. I'll take you over here. This is kind of our care plan, or what we call a discharge board or communication board. So the team and the family is an integral part of our team. We really promote family integrated care and family centered care. So you have everything from little cute things like my name is, my loved ones are, my birthday. And then there's also an opportunity for parents to write any questions or comments that they have to trigger them during rounds to communicate. Over here, we have a little bit more of a family area, family zone, with some privacy and some curtains. This chair kind of pulls out like a cot. So pre-COVID, both parents were allowed to stay here overnight, but with COVID, we just allow the one parent to stay overnight. This is a gorgeous zero gravity chair that we have that promotes kangaroo care or skin to skin, another integral part of our care in NICU. We do have a fridge in each of the rooms intended for breast milk, a breast pump, and the warmer, and all of the medical equipment as well. This is hidden behind here, which is nice. So it is really, we're trying to promote a home away from home for the parents to try to make it as comfortable as possible. Moving along over here, we have this state-of-the-art baby Leo. And I think Dr. Narvi will talk about this and show you more of the features pertaining to this in a little while. Another cool thing I wanted to point out was these cameras. So in our large facility, we do have the ability to monitor the babies with this camera. And there's a live stream of the camera outside of the room so that the nurses can monitor the infants closely. And we can move it around. So if you want it specifically on the baby's face or as the baby moves and whatnot. So like I said, we'll talk about the baby Leo a little bit, but this is just the standard monitors. And this is a nice feature of having all the medical equipment kind of tucked in and hidden away so that parents really feel like they're at home when they can't actually be at home with their neonate.
Thank you so much, Amanda. Dr. Narvi, what can you tell us about care here in the NICU and about this equipment in particular?
Thank you, Kat. As far as care goes, we see about 1,200 babies that come through this unit a year. So that's a lot of babies. We also have the privilege of finally being all united. Once upon a time, just a couple of years ago, babies were born in one hospital and had to come a long way to get to the intensive care unit. And now we're all under one roof. Obstetricians, respiratory therapists, neonatologists, nurses, the whole team is all under one roof. And so when your baby's born premature, given that it is World Prematurity Day, that's what we'll talk about. When they're born premature, you're just a short ride on an elevator away from the destination that will be yours for perhaps 5 to 6 months for our most premature infants, which actually leads me to want to show you this. Because as I said, when a baby is born prematurely, sometimes if a baby is born, let's say 24, sometimes 23 weeks, you can expect that they're going to stay in the hospital for about 5 to 6 months. That's a really long time. And as Amanda said, we like to think of this as a home away from home. And so I would like to just thank again the Sandra Schmirler Foundation, who I have had many interactions with, and I appreciate all of the generosity, and especially this $90,000 gift to the foundation. It means so much because it allows us to purchase a Cadillac, if you will. The baby Leo has so many features that are so important because, again, when you're going to stay this long in an environment like this, wouldn't you want to have some of these features? So I'll just go through some of the features. The babies have been developing in a very warm environment. Mothers are warm, 37 degrees. And so we want to maintain their body temperature outside the womb. And the heating system that we have in the baby Leo is a wonderful way to do that so that they don't have any stress from being cold. Now, sometimes, because we are in an intensive care unit, you need very quick access to the baby. Now, what's wonderful about this is we have these side ports here. These are very wide, allow us to enter very easily, okay? And it also allows, if you will, moms and dads that are sitting in a kangaroo chair or adjacent can reach in and touch and comfort their babies. Now, sometimes, sadly, we do have to do more aggressive care when a baby is getting really sick. And a nice feature of the baby Leo is the ability, with just a quick touch, to open it up so that the whole team, if we have a respiratory therapist, a nurse, a doctor that needs to gain quick access to the infant, we can do that. And this wonderful heater up here, I talked about temperature control. This heater allows us to keep your child warm. So these are really great advantages. Another advantage is I just lower this, and it lowers very easily, as you see, so that we can go back to the typical home that your child will have. A couple interesting features. One of the things that is so important that we have to always be mindful of is preventing infection in the newborn. And so one of the great advantages of the baby Leo is that the baby Leo has a system for humidifying the air in here to maintain warmth that really prevents bacteria from gaining entry. And that's a safety issue. The last thing that I wanted to point out, which I think really is one of the nicest features that I've seen on an incubator, and again, grateful for this gift that would allow us to get this. You can't see it, I don't think, well, maybe you can. We're virtual, so you can come over. There is a little jack over here on the side of this bed that allows us to connect an audio device, and you can record the mom's heartbeat. You can record mom or dad telling a story in a very sound controlled, protected level. You can play that within the isolette or the incubator here for your baby to hear. So while baby was developing in the womb and was hearing that mom's heartbeat, a little comfort would be hearing that mom's heartbeat after delivery. And we can now do that with the baby Leo. So we appreciate the gift once again.
Thank you so much, Dr. Narvi, for telling us about this gift, for which we are so grateful. Now we're going to turn it over to Karen Netzel, who is the coordinator of our volunteer parent program, to tell us a bit about her experience and about the program itself.
Sure, thank you. I think the first thing you have to know about me is that I was one of those parents that was in the old unit. And if you can imagine how blown away I was when I saw this new unit and the new equipment that they have, it's amazing. I gave birth at Women's Hospital, had to go a quarter mile through the tunnels to get to see my baby. And now it's all in one place, which is absolutely incredible from a parent perspective, knowing what it was like before. So a little bit about my story. I was 25 weeks pregnant and woke up one day and knew something was definitely wrong, and came into the hospital. And by the time I got here, I was in full labor and they had to deliver my son. And he was 25 weeks and 809 grams. So, I think as a parent, you're at the happiest point of your life, and suddenly your world is just rocked and you're just struggling to keep up with what's happening. It's terrifying. I can say the first time I saw my baby it's emotional for me now. But to come into NICU and see the equipment, see all these wonderful people who are looking after my son, really gave me a great deal of confidence. And I knew that, we were kind of all in this for the long haul, right? So I think I don't want to talk too much about the medical stuff because I'll leave that to Dr. Narvey. But as a parent, you're thrust into this world and you have to start to understand neonatology. And there are so many terms and things that you have to learn. And I was a banker, so I had no idea about any of this, but the staff was very good at teaching me so I could learn all of it. At that stage, I was counting his life by hours. It was hour by hour because I didn't know if he was going to survive. When I kind of got a little bit more comfortable after he had been around for a little while and I was sort of counting in days, he crashed at 8 days old. I got that phone call that said, you have to come in immediately. And I found out that he had to have surgery because he had perforated his bowel. At that point, he wasn't even stable enough for them to move to an OR. So they built an operating room around him and they took out 2 sections of the small intestine. And I don't know if anybody really thought he was going to survive that day, but he did. And I think that was the day I realized my boy was a real fighter. So we settled in for 7 months of a stay after that. Luckily, at that point, I didn't know it was going to be 7 months, but We stayed here for 7 months, and in 7 months, I dealt with all those things that a mom has to deal with. The loss of that perfect birth experience that you thought you were going to have. You know, the guilt of feeling that I had done something wrong to cause this. The strain on our relationship. You know, my husband and I, of course, we always leaned on each other for things. And now we were both going through the same thing. And it was a difficult thing to accept how he had to deal with it and how I had to deal with it. So there was a lot of work we did on our relationship in that 7 months. And in that 7 months, Matthew grew, he got better. We worried about his eyes. Would he be able to see? Would he be able to hear? He had a pretty significant bleed in his head. So would that mean cerebral palsy? Would he be in a wheelchair? We had no idea. His gut healed, so that part was good, but there were a lot of unknowns for us. And as a family, when you're in here, you don't know what the future is going to be, because obviously you had plans when you had a child, but now it could all be completely different. And I worried about stuff like, would he be in a wheelchair? We couldn't fit a wheelchair into our house at the time. Would we have to move? Like, all of these things go through your head. So if we fast forward to my position now, you can understand why I have such a passion for helping families. So because this position is funded in this hospital, I can be here to help families. I can be here to say, I know what you're going through. And I'm probably one of the few people who actually does know what families are going through, because I was there. I was feeling that panic. I was living that. And luckily, I was able to bring some veteran parent volunteers who also, prior to COVID again, were here to help families doing bedside visits, hanging out in our family zone for when families take a break so that they have someone to talk to. So that's all been a really big part of what I've been doing. I always feel like when you go through an experience like this, you know, sometimes you got to turn around and help the next person who's coming through it. So that's been our goal here, is to, as veteran parents, stand up and help other families. So one of the things that came out of the veteran parent program was our reading program. We found out that our language rates were low in Manitoba with our preemies, because there's a lot of sleeping, there's a lot of healing going on. They don't hear as much language. The baby Leo bed is going to help a lot of that, which is amazing, but we also need to read to our babies. So we have veteran parents delivering book bags and encouraging parents to read. One of the things when you're here, you try so hard to be a mom and you're not quite sure how you fit into that role in NICU. So we work with parents so that they can feel like they're parents. And we say, talk to your baby. But when we put a book in their hands, we give them the words. So it's much easier for them to read and for their baby to hear their voice. We also do a drop-in every Wednesday afternoon so families can meet each other, which is something really unique to me, because when I was in the unit, we didn't do that. They didn't encourage families really to meet. And now we have a regular drop-in where families can meet, they can share their experiences. We have veteran parents there to help them to talk about different things. We bring in education sessions so we can teach breastfeeding. We've taught baby massage. We've done all sorts of things in those sessions. So they've been really great for families. And luckily, we're able to start them up again now. So we're really excited to be able to provide that to parents now. Yeah, there's a lot that we're doing. So right now we're bringing volunteers back in. So we're rebuilding that program, and you know, hopefully we'll get it back up. We had 80 volunteers doing different jobs for families. So the baby cuddlers, of course, are the big one that everybody knows, but we had readers, we had massage therapists, we had crafters, we had all these people who generously donated their time to come in and help out families.
Thank you so much, Karen. Thank you to all the donors who are watching today who make this program possible. I think we're going to jump back to Stefano.
Hi, can you guys hear me? I think we're going to jump to Bernadette from the Sandra Schmirler Foundation, and she's going to bring a few words. Thank you, Bernadette.
Oh, thank you, Stefano. That was just an amazing tour. I'm the chair of the Sandra Schmirler Foundation, and we have a very dedicated board, volunteers, and our wonderful support team that help us raise money for initiatives like this. And it is just so heartwarming to see what has been done at your hospital. The wonderful facilities. The baby Leo is amazing. And I think you said that our last donation allowed you to buy 2 of those. Well, we'll be taking that back to our board, and I'm hoping we can get some pictures and feature it in our newsletter so that all of our donors know the wonderful technology and what a difference it makes to the babies and the families. And to the volunteers, thank you so much. It makes such a difference. And, you know, Sandra was a real champion. And in, you know, the last couple of years before she passed away, she was so passionate about babies and her daughters that I know that this would warm her heart. And we can't thank you enough for using the money we've raised for such wonderful things. And all champions start small. And we're pleased to be part of that. It's very heartwarming. Thank you very, very much.
Well, thank you, Bernadette, and thank you for your presence here today. And, you know, Karen, just thank you so much for sharing your story with us. And much more than that, just sharing your lived experience in helping families, parents, moms, those little guys through perhaps the most challenging times of their lives. And we're just so thankful that you're there, you know, providing that type of love and that type of support. And we value that tremendously. You know, Bernadette, thank you so much. We're so appreciative of the generosity of the Sandra Schmirler Foundation. It's a long-standing relationship, partnership, collaboration that we have. And it's just amazing to see what your foundation has been able to do through your generosity and advancing things like this incredible piece of equipment, which would not be here today without your support.
Well, and Stefano, I'd just like to highlight, I know there's a number of the board members that are participating, and our support team are on the call. And we were so thrilled this year, you know, with the pandemic, nobody knew what fundraising would be like, but our donors you know, came forward, and we gave out across Canada this year $1 million to NICUs. So we have made donations to every province and jurisdiction across Canada that we're very proud of, and that we're helping babies across this great nation. And of course, in Manitoba is the heartland of curling. And of course, that was Sandra's other passion. And so we're so pleased to be part of the successes that are happening in Manitoba and Winnipeg.
Thank you so much for lifting our NICUs across Canada. Your gifts make a huge difference to the families and our tiniest patients and staff who care for them. Wow, what a really moving morning. I'm always moved by the generosity, by the stories, by just the leadership in our hospital. Thank you so much, Dr. Narvi and Amanda. You walked through that room and all the technology in a way that I could even understand. So thanks to all of you, our donors, our stakeholders, for just taking some time out of your busy schedule and joining us for this virtual visit today. We're going to now open up to questions. Please use the chat function. Please identify yourself, and we will take as many questions as possible. Back to you, Fox. Any questions, Kat, coming in?
Yes, we have a question Dr. Narvi is going to address. We've been asked about the organization of the unit and also about how feeds are prepared.
Well, as Amanda mentioned, we have a 50-bed unit. And so with so many beds, it has a lot of space. So if you've never been here, and I would imagine many of you have never been here who are listening or watching, the unit is about the length of a football field. And so we have 5 different pods. We have some double rooms and we have many single rooms. And we have 3 teams that cover the distance. So we have, named after trees, we have aspen, birch, and cedar. And there's a neonatologist running each of those services as a medical lead. And we have nursing staff, other medical staff that are attending to the babies on a daily basis. We have the volunteers that you heard about. We also have dietitians and physiotherapists and occupational therapists and social workers. And I know I'm going to leave somebody out, respiratory therapists and pharmacists that all contribute to the care of these babies. Because really, I know it sounds a little corny to say this, but truly it takes a team, or it takes a village, to raise these kids from that tiny, fragile state to a state at which, they can finally take their baby home. And so that's the structure of the unit. It's a lot of walking. We get our steps in on a daily basis. There's no question about that. And I mentioned before, and I'll just reiterate, we are one floor down from the labor floor. And the way we structured our unit is that when a baby's born upstairs, it's actually a fairly short distance to go down the elevator and come into the unit and go right to the place where they're going to spend days to weeks, sometimes to months.
Thanks so much, Dr. Narvey. Now, Amanda, are you able to tell us a bit about how feeds are prepared?
Yeah, so actually we have an infant nutrition prep room, and the feeds are prepared by the dietitians and their diet tech team, and it's actually located down the hall over there, which we unfortunately can't show you that area, but there is a sterile hood that's utilized, and everything is sterile and prepared under that hood. We've actually recently implemented a nutrition tracking system, Bridge, milk management system. So that's assisted as well. So babies have little barcodes, and we would scan the milk to the barcode. So that's really assisted with our process. And that was just implemented, I think, a few months ago. So that's kind of a newer technology that's been utilized here in the NICU.
Great. Thank you very much. Do we have additional questions?
We do. So we have a question about what the best way to provide books and baby preemie clothes to the NICU is. And so maybe we'll put that.
That's fabulous. So we don't really accept donations of books to our library, but if you take your used books to the Children's Hospital book market when it reopens, those are the funds that come to us. They come to our Children's Hospital Library, and the Children's Hospital Library purchases our books. And so you should also know about our library that we take the books apart, we laminate them so we can clean them and bring them into the room safely. And we carry a lending library with us because, as I know, if you're here for an extended period of time, you need new material. So we gift, we have sewers that sew book bags for us. And then we stuff them with books and rhymes and different things for families. And then when we deliver our book bags, we're also carrying the lending library so we can keep parents reading and hopefully get them doing it daily as a routine. So, so the best way is to donate to the Children's Hospital Book Market or to Children's Hospital Foundation. And then we purchase the books that way. So we unfortunately don't just take donations of books. Preemie clothes, we can take them, we bring them in, they all go through hospital laundry, so they are safe for us to use. And probably the best thing would be to connect with me, and because you can't just come into the hospital right now to drop off a donation. So I meet people at the front doors, so they pull up, I grab the donation, and then I bring them up here to the unit and we use them.
Thank you so much.
We have many more questions.
Oh, one more thing. In terms of donations, you can go to goodbear.ca, and any donations specifically for things like books can be made to can be made via the Child Life Program, or just where it's needed most. You can indicate that as well. So at goodbear.ca.
That question. My son is 25 actually. And so 25 years ago, a 25 weeker was a 50-50 chance of survival. And the after effects were a lot. So for everything that he went through, he is doing awesome. So I will say he has mild cerebral palsy. He has a global learning difficulty. So he's out of high school now, so he's in a day program that is providing him work opportunities and some recreational opportunities. And I have to say that one of the things when you go through this, you ask yourself a lot, why is this happening? Why is this happening? And I think, as I've watched him grow, I know that that was exactly the way it was supposed to go for him. So I know this is what his life was meant to be. And he is like such a light in the world. He's an amazing boy. So I'm very fortunate.
Well, thank you, Karen.
In the NICU, and how many of them are the Leo model, and are more Leos needed?
I think off the top of our head, we don't know exactly how many incubators total there are in the unit. Having said that, we've just started purchasing the Leos. We had a model of incubator that we used in the past that we believe it was not as good as the Leos. So to answer the question, we have a few Leos, but we are definitely seeking more. Features like I spoke about, such as the easy opening, is really important. If you're in an emergency and you need to get access to your infant quickly, there's no faster mechanism I've seen than what the Leo offers. And I myself, having done, having an interest in research having to do with music therapy or maternal voice and the calming effect, reduction or greater cardiorespiratory stability when you hear mom or dad's voice. Having that feature on the side there to be able to pipe in the sound so that, it's almost like a seamless transition. You've been hearing your mother's voice and her heartbeat, and now you can still hear your mother's voice and heartbeat, even when mom can't be here, or dad can't be here, or two moms can't be here, or whatever combination it is. And if the parents cannot be here, we can have a means by which we can still have them feel like they're present to the child. So I think that if there's people out there that feel so inclined as to give a generous gift of a baby Leo, we would certainly happily take it and begin to replace our fleet of aging beds that need to be replaced.
Thank you so much.
What is the lifespan of an incubator or a Leo or other kind of NICU equipment that's very important?
Don't know exactly, but I think it runs along the lines of around 10 years, again, give or take with the newer technology. The nice thing about this Leo as well is, Dr. Narvi mentioned, is it doesn't need to be plugged in. So it's an hydraulic system to actually pop that off. So a lot of our older incubators, it's necessary to be plugged in to actually access. So that's a huge safety feature as well, as Dr. Narvi mentioned, because when we need that emergent access to the baby, it doesn't need to be plugged in, which could be a deterrent at some time. So I think it's about 10 years, but we have seen them last even longer.
I would just add to that. I agree with the 10 years. I wouldn't disagree with you on a Zoom chat like this, but I do agree it's 10 years. And I think the key there that you said, and I just want to emphasize, is technology. The features that we've just talked about here didn't exist 10 years ago. And so even if the machines are still working, what we want to do, what our job is, what our passion is delivering the best care to our babies that is possible on the market at any given time. And if we believe there's something that we're not providing that we could be providing, that's where the generosity of donors becomes so important to make sure Manitobans receive the cutting edge technology when it comes to caring for their children.
Thank you very much.
So we have one last question. A parent from over 30 years ago is really excited about this wonderful facility and wonders if there would be any cost for patients. So that would be covered in the Manitoba Health.
Yeah, no,
Yes.
There's no cost.
Okay,
Wonderful.
so those are all of our questions.
Thank you.
Thank you very much.
So again, thank you all so very much for joining us today here in the HSC Winnipeg NICU. We're absolutely grateful for all of your support, all of the donations. If you have questions for us, you can always pop us a note at info@goodbear.ca. And again, if you would like to make any kind of contributions and support, which Dr. Narvi and Amanda and Karen have talked about, by all means, visit us at goodbear.ca. You can also read more stories about a number of kids that have been helped over the years. Thank you again to the Sandra Schmirler Foundation. Bernadette, you and your team, thank you so very much for joining us. And Stefano, if you've got a last word, I will leave it with you.
Thank you. Thank you, everyone, for taking the time, and all the panelists. Just a wonderful introduction to the wonders of NICU. Have a great day, everyone.